and welcome to the training session on weekly COVID-19 vaccination data reporting for non-long-term care facilities. My name is Elizabeth Kalisle, and I work with the Division of Healthcare Quality Promotion at CDC. So there are 4 objectives for today's webinar. The first objective is to introduce the value in reporting weekly COVID-19 vaccination data. Next, we will go over how facilities can use NHSN to track weekly COVID-19 vaccination data for healthcare personnel. We'll review the module changes for September 2021. And at the end of the presentation, we will review how to report data in detail. Now let's talk about how we can use the COVID-19 vaccination data collected through NHSN. The NHSN modules are designed to ensure that reporting of COVID-19 vaccination percentages are both consistent over time within a single healthcare facility and comparable across facilities. Tracking vaccination coverage on a regular basis is important because coverage can change as new staff are hired. Accurate reporting of COVID-19 vaccination coverage rates can help facilities with their own efforts to track and improve these rates. By using NHSN, vaccination coverage data can be made available to authorities at the local and national levels. These agencies can use vaccination coverage data to help identify coverage gaps and issues surrounding vaccine supply. The data can also be combined with data on infection rates to inform infection control policies and recommendations. So now we'll cover the data elements that can be reported each week. COVID-19 vaccination data for healthcare personnel working at non-long-term care facilities are entered through the healthcare personnel safety component. This slide shows an example of the data entry screen. There are 5 key questions for this module. First, what is the number of current healthcare personnel eligible to have worked at the facility? Second, what is the number of these healthcare personnel who have ever been vaccinated for COVID-19? This number is the cumulative number of vaccinated healthcare personnel. Third, what is the number of these healthcare personnel who did not receive vaccination due to other conditions, for example, medical contraindications? The fourth question asks for the number of healthcare personnel who have received an initial complete COVID-19 vaccine series and who are eligible to receive an additional dose or booster. The final question, number 5, asks for the number of personnel who have received an additional vaccine dose or booster since August of 2021. So now we'll go over the key updates that were implemented for the module. New categories of personnel have been added to the form. Facilities are now required to report on employees as well as 3 non-employee categories, including licensed independent practitioners, adult students, trainees, and volunteers, and other contract personnel. A monthly reporting plan will also be created before entering weekly vaccination data. Question 3.2, offered but declined COVID-19 vaccine, and question 3.3, unknown COVID-19 vaccination status, were previously optional, but now these fields are required. A new rule has also been built into the NHSN application that requires all personnel reported in question 1 must be accounted for in question 2 or 3. We realize that there are several changes, so throughout the presentation, we have placed a green star next to the key updates for your reference. So the first question on the weekly COVID-19 vaccination data collection form asks for facilities to report on how many healthcare personnel were eligible to have worked at the facility for at least one day during the week of data collection. Facilities should include personnel who are regularly scheduled to work inside the facility. This means that a person is scheduled to work in the facility at least one day every week. Working any part of a day is considered as working for one day. Facilities should include regular workers, even if they are on temporary leave during the week of data collection. And temporary leave is defined as leave less than or equal to 2 weeks in duration. And this includes sick days or vacation days. If temporary leave extends past 2 weeks, then the worker should not be included in question 1 for the week of data collection. Please note that data must now be entered for each of the healthcare personnel categories. Also, each individual should be counted only once in question 1. Another change facilities will now see on the data entry screen is that totals for all core healthcare personnel and all healthcare personnel will now be auto-calculated by NHSN. All core healthcare personnel is defined as the sum of 3 categories: employees, licensed independent practitioners, and adult students, trainees, and volunteers. All healthcare personnel is defined as the sum of all 4 categories, including other contract personnel. Now we will go over the specific categories of healthcare personnel. Employees are defined as all persons receiving a direct paycheck from the healthcare facility, regardless of clinical responsibility or patient contact. The second category consists of non-employee licensed independent practitioners, specifically physicians, advanced practice nurses, and physician assistants who are affiliated with the facility but are not on the payroll, regardless of clinical responsibility or patient contact. Please note this category also includes post-residency fellows. The third required category consists of non-employee adult students, trainees, and volunteers who are aged 18 and older. This is defined as medical, nursing, or other health professional students, interns, medical residents, or volunteers aged 18 or older who are affiliated with the healthcare facility but are not on the payroll, again, regardless of clinical responsibility or patient contact. The fourth category consists of non-employee contract personnel. Contract personnel are defined as persons providing care, treatment, or services at the facility and through a contract, but who do not fall into any of the other personnel categories. Please note that this includes agency or PRN staff who are scheduled to work at the facility at least once a week. So now we'll move on to reviewing question 2. Facilities should report the cumulative number of all personnel each week in question 1 who have ever received COVID vaccines since December of 2020. So for instance, 10 healthcare personnel may have received dose 1 of a COVID vaccine during the first week of data collection. During the second week, 5 more personnel received only dose 1 of a COVID-19 vaccine. So for week 1, a facility would report that 10 healthcare personnel received dose 1 of a COVID-19 vaccine. But for week 2, a facility would report that a total of 15 healthcare personnel received dose 1 of a COVID-19 vaccine. So let's go through the steps of reporting vaccination data. You will see a drop-down box of COVID-19 vaccines. Click on the box and select the vaccine for which you would like to report data. At this time, you will see the Pfizer, Moderna, Janssen, and unspecified vaccines in the box. The second step is to enter the cumulative number of current healthcare personnel who received only 1 dose of the vaccine. The third step is to enter the cumulative number of current healthcare personnel who received both dose 1 and 2 of the vaccine. Healthcare personnel may have received different types of vaccines. So for step 4, if some individuals received another type of vaccine, return to the drop-down box and please repeat steps 1 to 3. This slide outlines some key points about question 2. Facilities should include healthcare personnel receiving COVID-19 vaccine at the facility or elsewhere. For individuals receiving vaccine elsewhere, they should provide documentation of vaccination. If documentation is not provided, the healthcare personnel should be included in question 3.3, which is for unknown COVID-19 vaccination status. Please note that the Pfizer and Moderna vaccines require 2 doses for full vaccination. Only 1 dose is given for the Janssen vaccine. If an individual's medical record indicates they received full COVID-19 vaccination outside the facility, but information for the specific vaccine manufacturer is unavailable, the facility should report these individuals in the unspecified manufacturer category. After a facility enters data for question 2, NHSN automatically calculates the number of individuals who have completed their vaccinations and are fully vaccinated. So in this slide, you will see that a total of 64 individuals have completed their COVID-19 vaccination series. So this is an example of healthcare personnel receiving dose 1 and 2 of the Pfizer COVID-19 vaccine. Last month, 20 healthcare personnel received dose 1 of the vaccine. But for this week, 2 of the 20 healthcare personnel received dose 2 of the vaccine. The 18 healthcare personnel who have not yet received their second doses would still be reported as receiving only dose 1 of the vaccine. The 2 healthcare personnel who received dose 2 of the vaccine would then be reported as receiving dose 1 and 2 of the Pfizer vaccine. Now we will discuss question number 3. Question 3.1 is required and asks facilities to report the cumulative number of healthcare personnel in question 1 who have a medical contraindication to the vaccine. Please note that the term exclusion is listed in question 3.1 in the NHSN application. However, this is no longer used, and facilities are encouraged to consult CDC guidelines using the link listed on the slide for the most current information on medical contraindications. Medical contraindications are comprised of having a history of severe allergic reaction to vaccine or components. Questions 3.2 and 3.3 are now required. Question 3.2 asks for the cumulative number of personnel in question 1 who declined COVID-19 vaccine. For this question, facilities should include individuals who declined a vaccine for philosophical, religious, or other reasons that are not considered medical contraindications as defined in question 3.1. Question 3.3 asks for the cumulative number of individuals whose vaccine status is not known. So for example, facilities may include individuals who might claim to be vaccinated, but do not have documentation for this. When completing data entry, please note that all individuals included in question 1 must be accounted for in questions 2 and 3. If the sum of numbers entered for question 2 and 3 do not equal the total number of individuals entered in question 1, an error message will appear on the screen in the NHSN application. For question 4, facilities report on the number of healthcare personnel in question 2 who are eligible to receive an additional dose or booster of the COVID-19 vaccine. We will now go over a few key terms. Fully vaccinated refers to an individual who has completed an initial vaccine series. An additional dose or booster refers to COVID-19 vaccine received at least 2 weeks after completion of an initial vaccine series. Specifically, an additional dose is administered when the immune response following an initial completed vaccine series is likely to be insufficient. A booster dose is administered when the initial sufficient immune response to a completed vaccine series is likely to have waned over time. Please note that a booster dose is not yet approved, and the Advisory Committee on Immunization Practices is expected to issue booster dose recommendations based on a thorough review of the evidence. Please refer to the link listed on this slide for guidance to determine healthcare personnel who are eligible to receive additional doses or boosters. Healthcare personnel should be counted as eligible to receive an additional dose if they received an initial complete 2-dose mRNA COVID-19 vaccination series at the facility or elsewhere since December 2020, and if they're eligible to receive an additional dose or booster of the vaccine per CDC guidance. When determining individuals who are eligible for an additional dose, facilities are encouraged to do their best. For healthcare personnel, facilities may not have access to the medical information necessary to determine eligibility. In these situations, facilities should report any healthcare personnel who received an additional dose as eligible to receive the dose in question 4. Question 5 asks for facilities to report on the cumulative number of healthcare personnel in question 4 who received an additional dose or booster of the vaccine at the facility or elsewhere since August of 2021. Weekly cumulative data should still be reported for this question. So for example, in week 1, 5 healthcare personnel received an additional dose or booster of the vaccine. In week 2, 3 more healthcare personnel received an additional dose or booster. Therefore, for week 1, facilities should report that 5 healthcare personnel received an additional dose or booster. But for week 2, facilities should report that 8 healthcare personnel received an additional dose or booster. So now we'll review the steps on how to report data for additional doses or boosters of the vaccine for question number 5. You will see a drop-down box of the COVID-19 vaccines. Click on the box and select the vaccine for which you would like to report data. Next, you will enter the cumulative number of healthcare personnel who received an additional dose or booster of the COVID-19 vaccine. Healthcare personnel may have received different types of vaccines. So for step 3, if some personnel received another type of vaccine, you would need to return to the drop-down box and repeat steps 1 and 2. After a facility enters data for question 5, NHSN automatically calculates the number of individuals who have received an additional dose or booster. So now we'll review a few notes about completing questions 4 and 5. A facility may not have any individuals who are eligible to receive an additional dose or booster. So in this case, since questions 4 and 5 are required fields, please enter 0 for question 4 For question 5, select any manufacturer from the drop-down box and enter 0. If a facility does not have any individuals who received an additional dose or booster of the vaccine, facilities should select any manufacturer from the drop-down box and proceed to enter 0 for question 5. Please note that only individuals who received an additional dose or booster should be reported in question 5. So now we'll review a few scenarios that facilities may encounter during data reporting activities. A facility may not be able to determine if an individual is eligible for an additional dose at this time because they do not know the individual's health status to identify if he or she is moderately to severely immunocompromised. In this case, the individual should not be reported in question 4 or 5. In another example, a facility has a staff member who only received dose 1 of the Moderna COVID-19 vaccine. However, the staff member expressed an interest in receiving an additional dose of the vaccine. In this instance, the facility should not include the staff member in questions 4 and 5, since he or she did not complete an initial COVID-19 vaccination series. In a third example, a facility is not aware or unable to determine whether any staff members currently meet the eligibility criteria for receiving an additional dose or booster of the vaccine. However, 2 staff members have documentation of receiving an additional dose. For this case, the facility should assume that these 2 staff members were eligible to have received an additional dose of the vaccine and include these staff members in question 4 and 5. Question 6 consists of required questions on the availability of COVID-19 vaccines for healthcare personnel. First, indicate if your facility is enrolled as a COVID-19 vaccination provider. More information on steps a facility can take to enroll as a COVID-19 vaccination provider is described using the link listed on the slide. If the facility is enrolled as a provider, indicate if the facility had sufficient vaccine supply to offer all healthcare personnel the vaccine. If the facility is not enrolled as a vaccine provider, indicate if the facility has made other arrangements for healthcare personnel to receive vaccine. For example, the facility may have a referral system in place for personnel to receive vaccination at a health department or pharmacy. There is also a field in the application where facilities can describe any issues with vaccine supply. COVID-19 vaccination coverage among healthcare personnel is an NHSN measure for endorsement by the National Quality Forum. The measure is defined as the percentage of healthcare personnel who received a complete COVID-19 vaccination series. Data on additional and booster doses are required in the NHSN application and help to inform public health response. The measure refers to data submitted for employees, licensed independent practitioners, and adult students, trainees, and volunteers. For information about CMS reporting requirements, please see the links listed here. Facilities can contact CMS with questions about requirements for the Inpatient Quality Reporting Program using the email address provided on the slide. Finally, CDC would like to remind facilities to report any adverse events to the Vaccine Adverse Event Reporting System, or VAERS. When completing a VAERS report, please enter the facility's 5-digit NHSN org ID in box 26 of the VAERS form, as this will assist with identifying reports from NHSN sites. Serious adverse events include death, life-threatening conditions, or inpatient hospitalization that occur after vaccination, even if it's not certain that vaccination caused the event. Facilities should also report vaccine administration errors. Please note that other clinically significant adverse events may be outlined in fact sheets for provider emergency use authorization or prescribing information. CDC has created a table of instructions document that provides definitions for all categories and questions on the data collection form. Facilities should review all instructions before collecting and entering COVID-19 vaccination data into NHSN. This slide reviews a data tracking worksheet that CDC developed. This is an optional tool in an Excel spreadsheet format that is designed to help with data collection. Facilities can enter healthcare personnel vaccination information and then select the week of data collection. The worksheet will automatically calculate data that should be reported to NHSN each week. CDC is currently updating the worksheet, and a revised version will be posted on the NHSN website within the next 2 weeks. So now we'll briefly talk about the steps you'll need to take to report weekly COVID-19 vaccination data in NHSN. First, we'll go over some key roles in NHSN. The facility administrator is the person enrolling the facility in NHSN and is the only person who can activate additional components for the facility, has add, edit, and delete rights to facility data, users, and users access, has the authority to nominate or join groups for data sharing, and is the only person who can reassign the role of facility administrator to another user. Users have the ability to view, enter, and analyze data, but these rights are determined by the facility administrator. For facilities to participate in the healthcare personnel safety component, they must enroll in NHSN and activate the component. Please note that the process of enrolling a new facility can take a minimum of 4 to 6 weeks. Enrollment in NHSN is required for facilities that are currently not participating in NHSN but wish to participate. If a facility is already enrolled in NHSN and wishes to participate in the healthcare personnel safety component, the facility must activate the component. We'll now go over a few main points for new users to NHSN. Once new user information has been saved in NHSN, that user will receive an automated Welcome to NHSN email with instructions to begin the process of becoming a NHSN user. After agreeing to the NHSN rules of behavior, the new user will receive an automated email to register with SAMS. SAMS stands for Secure Access Management Services and provides secure online access to CDC applications such as NHSN. After registering with SAMS, the new user receives instructions to create a SAMS account and complete an identity verification process. During the process, be sure to follow the instructions carefully to prevent delay in processing the documentation. You will receive confirmation from SAMS once documents are approved, and a SAMS grid card will be issued to you. Please note that it will take at least 2 to 3 weeks for a new user to be able to access NHSN. Users should be sure to log into NHSN using the SAMS card at least one time each year so that it will remain active. Because the SAMS card is user-specific and not facility-specific, an individual with user access to multiple facilities through the same email address could enter data into these facilities. More information about the SAMS process can be found using the link on the slide. NHSN highly recommends that if there is a change in the NHSN facility administrator, that he or she should transfer that role to another user prior to leaving the facility. If the previously designated NHSN administrator has left the facility, prior to reassigning the role, you will need to reach out to the NHSN help desk to have that role manually reassigned. You can request this reassignment using the Facility Administrator Change Request form using the link on the slide. After the help desk completes the reassignment, the newly designated facility administrator will be able to start the new NHSN user onboarding process. Now that we've gone through some information about accessing the application, we will now focus on data entry. Once you're on the NHSN landing page, facilities will need to select the healthcare personal safety component. Once you're on the home page for the component, click on COVID-19 Weekly Vaccination Summary on the left-hand navigation bar. You will then see a screen in a calendar format for the vaccination summary data. Before beginning to enter data into an NHSN for a particular month, facilities will now need to create a monthly reporting plan. The plan collects data on which modules and months the facility plans to participate. Users should select options to enter data from the weekly COVID-19 vaccination module section of the plan. Please note that Level 3 SAMS access is needed to create a plan in the healthcare personnel safety component. To add a monthly reporting plan, click on Reporting Plan and then Add on the navigation bar. So this slide shows what a hospital with inpatient rehab and inpatient psychiatric units will see on their screen. You will need to select the correct month and year from the drop-down menus. Each hospital or unit should check the appropriate box. For example, to report data for your hospital, you would check the COVID-19 vaccination summary for the hospital. Click on Save after making the appropriate selections. Please note that units with different CCNs should be reported separately from the acute care facility. Facilities that are not reporting data for inpatient rehab units or inpatient psychiatric facility units will see a different monthly reporting plan screen. Similar steps should be followed as described previously, as facilities will need to select the correct month and year from the drop-down menus and check the appropriate box next to COVID-19 vaccination summary, and then click Save. A message stating that the plan has been saved successfully will appear. Click Next to proceed to update the plan for another month. And please note that facilities can create multiple plans in advance. Facilities will see yellow boxes on the weekly vaccination calendar indicating COVID-19 vaccination data can be entered. Next, click on the yellow box to enter data for a certain week. You will now see the data entry screen for inputting weekly data. The Tab key can be used on the computer keyboard to move across columns. If there are not any healthcare personnel reported for a required field, please enter 0. And note that the required field is designated with asterisks. Click on the Save button at the bottom of the screen after entering your data. After clicking on the Save button, a message should appear on your screen indicating that the data have been saved successfully. Once data have been entered and saved in NHSN, you will see a green tab for each existing record on the calendar page. This example shows how a facility would edit data that were entered previously for healthcare personnel. After editing, after editing data, please click the Save button at the bottom of your screen. So let's take a brief look at the NHSN analysis and reporting functions. To generate data reports, facilities can use the analysis tools. There are resources on the NHSN website that review how to generate reports. However, please note that these reports are now organized differently into 2 folders. Reports on the COVID-19 vaccination folder include a default variable list with new healthcare personnel categories, while reports in the pre-10.0 folder contain the older default variable list. This slide shows a location of folders for freestanding inpatient psychiatric facilities and inpatient psychiatric facility units to access data reports. Similar to the previous slide, here are the locations of folders for the freestanding inpatient rehab facility and inpatient rehab facility units to access data reports. Now we'll review how to report cumulative COVID-19 vaccination data. So this slide shows you how COVID-19 vaccination may be reported for healthcare personnel who are eligible to have worked at the facility for at least one day during the week of data collection. In this example, the facility had 50 healthcare personnel who were eligible to have worked. 10 of those healthcare personnel received their first dose of the Pfizer COVID-19 vaccine, while 5 healthcare personnel received dose 1 and 2 of the vaccine. This example shows how COVID-19 vaccination looks during the second week of reporting. 5 more healthcare personnel received their first dose of the vaccine during this week. So at the end of the second week, the facility reports that a total of 15 healthcare personnel received their first dose of the vaccine. This example shows how COVID-19 vaccination looks during the third week of reporting. 15 healthcare personnel received their first vaccine dose in week 2. You would then add the 3 healthcare personnel who received their first dose in week 3. This gives you a total of 18. Of the 18 healthcare personnel, 10 received their second vaccine dose in week 3. Therefore, you would subtract 10 from 18. So for week 3, the cumulative number of personnel who received their first vaccine dose should be reported as 8. This example also shows how COVID-19 vaccination of healthcare personnel receiving their first and second vaccine doses looks during the third week. 5 healthcare personnel received their second dose in week 2. You would then add the 10 healthcare personnel who received the second dose in week 3. Therefore, for week 3, the cumulative number of healthcare personnel who received the second dose should be reported as 15. The next few slides will outline some resources that will be helpful to you. The Healthcare Personal Safety Component website contains links to a variety of training materials. If you have any questions about NHSN, please send an email to user support at nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of your email. This concludes the presentation. Thank you so much for your time.